Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Live webinar series.
Children's Healthcare Canada would like to thank the following Keystone funding partners for their ongoing contributions that support all of our programs and activities. The Stollery Children's Hospital Foundation, BC Children's Hospital Foundation, the Children's Hospital at London Health Sciences Centre, the Alberta Children's Hospital Foundation, the Children's Hospital of Eastern Ontario, and Holland Bloorview Kids Rehabilitation Hospital. We would also like to thank the organizations that provide funding for our knowledge translation activities, which includes this Spark Live webinar series, the Spark Conversations blog, and the Knowledge Exchange Network. To learn more about Children's Healthcare Canada, you can go to our website, follow us on Twitter or Facebook, or you can sign up for our weekly Spark newsletter at childrenshealthcarecanada.ca/email, where you will learn about upcoming events, read the latest posts from our blog, and other exciting news and events from across the child and youth healthcare community.
Hello, everyone, and welcome to Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson, your host for the next hour. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community with our goal to spark conversation, ideas, and action. Since we are live, I want to remind everyone that while we don't take questions over the line, you may all type into the question box at any time. Our speakers will respond to the questions at the end of the webinar, but please don't wait until the end to start typing your questions. Just put them in as you think of them. Today, we're delighted to partner with Solutions for Kids in Pain, or SKIP, to bring you COVID, its impact on kids in pain and their families. And I'd like to introduce my co-moderator, Katie Burney, who will say a little bit about SKIP.
Hi, welcome to everyone today. I'm Dr. Katie Burney. I'm a psychologist here in Calgary and Assistant Scientific Director of SKIP. And SKIP is a knowledge mobilization network, one of Canada's networks of centers of excellence, or NCEs. And we're a network across Canada really working to bridge the gap between existing evidence-based solutions and patient care in the area of pain in kids. In addition to myself, SKIP is co-led by Dr. Christine Chambers at Dalhousie University and Doug Maynard, who's Associate Director at Children's Healthcare Canada as well. And very delighted, as Paula will introduce all four of our speakers today, very delighted and thrilled that they have agreed to share with us. And we've organized today's session to leave lots of time for questions and discussion for the latter half. So looking forward to hearing from all of you.
I'm delighted to welcome our speakers today. Dr. Tim Oberlander is a physician scientist whose work bridges developmental neurosciences and community child health. He's a developmental pediatrician and works as the medical lead for the complex pain service at BC Children's Hospital. Thomas Young is a British physiotherapist now working in complex pain clinic at Alberta Children's Hospital, and he leads research around physiologically informed physiotherapy practice for Alberta Health Services. Dr. Jennifer Crodogino is a psychologist with the Pediatric Chronic Pain Program at Children's Hospital in London, Ontario, where she works with an interdisciplinary team to access and treat children and youth with chronic and complex pain. She's also an adjunct professor of Western University's Clinical Psychology Department and of the Department of Anesthesiology and Perioperative Medicine at the Schulich School for Medicine and Dentistry. And Delane Linkovich is a member of the Patient Engagement Committee of the Chronic Pain Network and the Steering Committee for Alberta Pain Research Network. Delane has been living with pain for the past 13 years and is passionate about advocating for people living with pain. For those of you on Twitter, please tag us at ChildHealthCan, at Kids in Pain, and with the hashtag It Doesn't Have to Hurt to any webinar related tweet and share away. And it's my pleasure to pass the mic to Delane.
Thank you. And first of all, I just want to say a big thank you for allowing me to speak to the chronic pain patients' experience during the COVID-19 pandemic. As Paula mentioned, my name is Delane and I live in Edmonton, Alberta, and I have been living with chronic pain since I was 12 years old. I have myofascial pain in my neck, back, and shoulders, and this was caused by a car accident my family and I were in that left us all living with chronic pain. And so since I've been living with pain for almost half my life, with the majority of that time being spent as a kid with pain, I wanted to give you all some insight into how the COVID-19 pandemic could be affecting kids with pain and their families. So many people are experiencing changes in their lives, and as we're all isolating and adapting to the situation that's going on in the world right now, and this poses difficulties for a lot of people, but for kids living with chronic pain, it can be especially difficult for them and their families. So I just want to talk a little bit about the challenges that other chronic pain patients may be experiencing, as well as their families. So even though some services are being offered through various virtual platforms such as Zoom, Skype, and FaceTime, many of the core pain management treatments, such as massage or acupuncture, are really inaccessible due to the hands-on nature of these treatments. And so with the current circumstances, children with chronic pain will probably not be able to access these services for the foreseeable future, which means that their pain may end up getting worse. I know even for myself, I've noticed that my pain has been flaring up because I'm not able to go and see my massage therapist on a regular basis. And another issue is that there's kind of a change in the way that we can exercise. So exercise is one of the most helpful things kids can do to manage their pain. However, due to the various closures of gyms, recreational facilities, and even playgrounds, some types of exercise are no longer really accessible. And so there also aren't designated times for exercise like recess because kids aren't in school. And so this really means that, children who normally exercised or did things like swimming or even playing sports will have to find ways to exercise at home in order to manage their pain. And one of the other things is a normal routine. And a normal routine may not seem like a big deal to most people, but for kids with chronic pain, a normal routine really helps to avoid flare-ups. And so due to the lack of normalcy and the disruption of routines since the beginning of this pandemic, kids may be experiencing more flare-ups. And this change in routine also really affects parents and caregivers of children with chronic pain, as they now may be tasked with things like working from home, homeschooling, and trying to help manage their children's pain as well. And so another big challenge that kids are facing right now is being out of school. And so now they have to adjust to learning at home. And so I know for myself, I found school to be a really good distraction from the pain I was experiencing every day. And so now that children have to stay at home, their pain may be more prevalent as school can no longer act as that sort of distraction. And so one of the last things I wanted to talk about was children with chronic pain and their families are probably struggling in these times of uncertainty with figuring out what pain management looks like for the near future. And so children and their families are probably experiencing higher levels of stress right now, trying to figure out how to reschedule appointments virtually, how to access medications. And, the list really goes on of things that children and their families are really trying to navigate right now during these troubling times. And so for kids living with chronic pain, they've already had to learn ways to adapt their lives. And now with the help of family and caregivers, they also have to learn how to adapt to self-isolating, adapt to doing schoolwork from home, and on top of that, adapt to living with and really managing their chronic pain during this COVID-19 pandemic. And so hopefully this has given you all some insight into the challenges that kids with chronic pain and their families are facing during this COVID-19 pandemic. So thank you very much, and I'll pass it over to Tim.
Great, thank you very much. First, I want to just thank the organizers for inviting me to join this very important conversation. Hi, I hope everybody can see the screen. I'd like to just thank everybody for inviting me. These are really extraordinary times, and it's important to remember that COVID-19 affects all of us, not just those who are infected, but the most vulnerable among us, particularly children and youth with chronic complex pain. In the next few minutes, I'd like to review what COVID-19 might mean for children, considerations for children's health, discuss the implications of chronic pain management in this context of virtualized care. In particular, I'd like to speak about the implications it has for pain in children with developmental disabilities. And finally, I'd like to just highlight the importance of the implications that this crisis may have for us caregivers working with children with chronic complex pain. So, COVID-19 in children is not well understood, and there is a recent paper that I'll direct the audience to. It came out last week in JAMA Pediatrics, highlighting some of what was known from the early experience in China. We know that children are typically more susceptible to influenza, which is not a coronavirus. And so far, though, we have lower than expected rates of COVID-19 disease, and deaths appear to be rare. In the early part of this year in China, 1.2% of the cases were aged 10 to 19 years, with a fewer than 1% less than 10 years. However, among children with COVID-19, the manifestations of the disease appear to be similar to that of adults, primarily a respiratory illness. Importantly, transmission is likely to be the same between adults and children, and therefore the precautions that we have put in place for adults remain the same. When we think about COVID-19 symptoms and its presentation, clearly they can be both non-specific as well as very specific respiratory symptoms. Tests at the early stages can be inconclusive or falsely negative. At a population level, not just those who are infected, there's an enormous amount of uncertainty, and we've all both experienced in our clinical practice and perhaps even in our own lives a sense of hopelessness, anxiety, depression, the social isolation that comes from the stay-at-home orders, reduced function, the stigma that appears, uncertainty about whether to even wear a mask, which now appears to be recommended in many jurisdictions. And for us at home, of course, there's limited or no access to health care or community resources. How do we compare that with what is typical of chronic complex pain? And we see that many of the presentations of COVID-19 are actually very identical. So here we have many conditions that have non-specific, very disabling symptoms. Tests are typically non-conclusive. There's enormous uncertainty, hopelessness, anxiety, and depression that comes from unrelenting, poorly managed, poorly controlled symptoms that lead to poor function, social isolation, the end of sports and school because of the pain and disability, the stigma of being disabled, and because of the lack of specialized health care, limited health and community resources often face children and families struggling with chronic complex pain. What are the considerations that we need to keep in mind when we're thinking about health care and pain management? Clearly, we need to start with the key public health messages: social distancing, hand washing, and staying at home. But that often leads, and almost universally that leads, to disruption in daily life, which includes a lack of access to typical therapy, medications. Delane mentioned the difficulty of getting medications renewed or going to the pharmacy, as well as the typical interventions from physiotherapy or psychology that are inherent to managing chronic complex pain. And with that limited access comes worsening symptoms, decreased health and mental health in particular, which then leads in turn to perhaps initiating new drug therapy, and that raises critical questions about drug-drug interactions. Typically, we manage chronic complex pain with a variety of psychotropic drugs that are often singularly fine, but in combination with other drugs can lead to either drug failure or unintended consequences of side effects. It's critical that we pay attention to that at this time. But inherent to all of this comes lack of access to school, education, social and physical activities that are a typical part of everyday life, social isolation, fear, anxiety, and the infodemic, as the WHO has called it, from unrelenting social media compound the pain, suffering, and disability that we typically see with chronic complex pain. Inherent to all of this are unintended consequences that we all also need to acknowledge and manage, including loneliness, limited services for children with developmental disabilities, which require in-home or facility-based care. And most importantly of all is that this highlights the worsening of health disparities that we know exist within our society, socioeconomic status-related access to care, housing, financial security, nutrition, social connections, which are inherent to our, sadly, are inherent to our society, are exacerbated and stressed at this time. I'd like to point out that the management of chronic complex pain in this period needs to include all of the typical medications that we have already started, but there has been, and I want to just highlight this particular aspect of medical therapy, that recently there's been some discussion about whether ibuprofen worsens COVID-19 symptoms. I want to just highlight that this has not been proven, and Health Canada in March 20th has issued this report saying that Canadians who currently use any NSAIDs, including children and youth, such as ibuprofen and naproxen, to treat their chronic diseases, should not stop their treatment and should speak to the healthcare professional if they have any questions about changing symptoms. This is a critical, important piece of news. So, how do we take positive steps to manage and treat chronic complex pain in this era of virtualized care? First of all, the coordinated teams are still highly relevant, and we need to have access to data across both time and space. For some, integrated systems already exist, but I think that it's important to acknowledge that varying resources exist for many of us that still rely on text, phone, and Zoom and Skype have its limits. But when in doubt, the phone is still a very appropriate way of staying connected. Engage individual children and families in personalized care plans still is highly relevant. But I think we have an opportunity here to streamline care, identify really what's important at this time. Of course, dealing with our own uncertainty, anxiety, and stress is critical to maintaining appropriate level of function. But I think we also have an opportunity here to consider opportunities for innovation and advocacy that may not have existed a month ago. What does a virtualized clinical encounter look like? Well, I think we already have the tools in our box. We already know how to assess symptoms and function. We know how to address and set goals, determine the need for investigations, or perhaps not. And I think here we have an opportunity to be even more parsimonious because of the lack of access to lab and imaging facilities. It's critical that we treat and respond to side effects of medications. When we add more medications, we run the risk of drug-drug interactions. Doing the physical exam on a Skype or Zoom platform is challenging, but it does give us a chance to think, what is it that is critical about the physical exam that we absolutely need to know, and what are the things that we could perhaps defer until a later date when we can be physically in the room together. We need to acknowledge that all of us have a great deal of uncertainty, both about how we're engaging in this virtual encounter, as well as the limitations of it. And I think that if we're all clear about what it is that we're doing, we will be less disappointed by the failure to do everything. Emphasize self-care and the need to engage in one's own recovery and treatment continues to be a critical part of pain management, even under these circumstances. Well, the critical question that I think certainly I face as a clinician, and I think I'd like to engage with the group about how to do this, but the real question that I think we have to tackle is how to connect when you can't lay hands on. The physical exam is really a critical part of assessment and healing, and how do we do that when we're only doing this by Skype? Well, first of all, the clinical encounter includes a critical part of the content that elicits an understanding of the cause and meaning. We can still do that across space and time. How does the clinician style come across? Well, this may take some learning, but I think that the basic ingredients are still relevant. A warm-friendly style matters. Active listening still counts. A thoughtful pause or silence while you're processing the findings or pondering a treatment plan still makes a difference. Conveying empathy can still be done across cyberspace. And a communication of confidence and positive expectations is clearly an ingredient that should not be left out. Chronic pain is also a part of a life of children with developmental disabilities, and we need to recognize that the combination of developmental disabilities, chronic pain, and COVID-19 offers a critical opportunity to consider what this means for vulnerable populations. Here are some items that I think that might help in our understanding of what we can do to keep things moving. Talk and communicate in typical ways is essential. Maintain routines, engage in calming behaviors, and schedule coping strategies. Use support networks, of course, at a distance. And monitor changes of symptoms, function, and behaviors, especially where complex medication combinations are being used, as I mentioned before. But we also, as providers, have a critical role to play in monitoring our own health and well-being. We're also humans, we're also involved in this, and this is not just a illness that in fact infects or affects our patients, but it also affects us personally and our families. Let's remember that we have to stay healthy and safe, focus on illness prevention and infection control. Loneliness and isolation is a critical part of some of our jobs. Stress and anxiety come with that, coupled with uncertainty and avoidable burnout. So the object of medical management of chronic complex pain in this era of COVID-19 requires us to keep it going. That requires us to acknowledge the situation. It's not great. It's actually quite uncertain. But we also need to convey a message of hope that while things are bad, we will be okay and it will get better. We need to monitor use of medications, focus on symptom reduction, and stress the importance of improved function in whatever way we can. Focus on key biorhythms, sleeping, eating, exercise, and stress reduction. And the importance of filling up our self-care toolbox. What is it that we need to share with our patients and families about the tools that they will be able to use long after this is over? And keeping a positive perspective is a critical part of long-term pain management. Thank you very much.
Okay. Okay, hi everyone. My name is Tom. I'm a physiotherapist from Alberta Children's Hospital. The accent tends to throw people, so I'm going to do my best to speak slowly. It's wonderful to be part of this great team and talk about this subject. Talk about some physiotherapy actions, and we're going to think about things we could consider immediately, in the medium term and the longer term. In the short term, I just encourage everyone really to pause and reflect. I think, as was mentioned in the last talk, this is a really difficult and stressful clinician. So I think it's good to actually just pause and kind of acknowledge that. As a clinician, maybe just encourage your clients to sort of really think hard about what do they need right now. Is exercise the main priority? How does not exercising make people feel? I think, as we know, at times of stress, pain can be significantly worse. When people are stressed, we have really different brain chemistry that tends to act like a magnifier to our pain systems. So it's going to be a lot more common to have moments of flare right now. And as such, I think it's important to look at what's in your most useful first aid kit. What do you normally do at times of flare? And if that's not exercise, that's okay. And I want to kind of stand here as a physio and really give you license for that. So when I'm asking you about how does not exercising make you feel, I think acknowledge that we all know exercise is useful and people already push that agenda quite a lot. Maybe you need something else right now. So, you know, that might be coloring, that might be doing a jigsaw, that might be reaching out to family and talking with somebody. And all of these things are awesome and okay. And I think you need to, again, acknowledge the moment and accept that it's a stressful time and say, what do I need most to get me over this hump right now? In the slightly longer term, I think, you know, that becomes less sustainable, and at some point we do think, well, let's get back to the things that I know have been useful for me historically, and that may well be exercise and movement. So I encourage you to, at this point, start to say, what is it that makes exercise super duper awesome and rad? And you may notice some really subtle power of suggestion there. I'm kind of canny like that, so watch out for it. And I think my point here is that exercise, the physical act of exercise, may not even be fun for you. That's true for lots of people. Lots of people really abhor exercise. And clinicians, I think, recognize this too. When you're asking your patients to do these things, know that exercise may not be the thing that really makes, you know, is enjoyable to them. So I think, again, reflect and say, what is it about exercise that does make it fun? And maybe that's a social connection. Maybe you have historically done exercise with a certain person. So it's not just the physical act we need to replace, but it's everything that comes with it. So can we be thinking, well, how else can I reach out to that person right now? Can I text them? Can I give them a call? Can we do some gaming online? Can I do something else? Because I think, as has been talked about, the point of routine and the point of normality, when we think about exercise, we think about the physical act, but we don't always think about all the other aspects. So encourage your clients to explore what exercise really means to them. What's the value behind it that drives it? Is it a sense of challenge? Is it a sense of accomplishment? And how else can you kind of explore these values in your life right now? Yes, so I think once you've maybe gone through these sorts of phases, then we get back to my wheelhouse. As a physio, if I don't tell you I love physio, at some point they will revoke my license. So when I'm thinking about exercise, I really want to reassure you that it continues to be the most powerful tool in your arsenal for managing chronic pain. And I would say also for helping manage with stress, which is going to be higher right now. So when I think about exercising in these unique times, I've tried to think about the things that might stop you from doing that, or stop your clients from doing that. And I think one of the big things is that when it comes to chronic pain, there's a real sense of prescription. And I think there's a real temptation to try and tell clients to move in a certain way, or if you are a patient, to feel that you have to move in a certain way because that's the only safe way to move. And I want to really reassure you that this may not be the case. In fact, I would say it's definitely not the case. I think unless you're doing a very high load activity, so a squat or a bench press with several hundred pounds, I don't think form matters that much. I think it's good to remind people and be reminded that even though you have pain, you can still have a powerful and strong body. You can have a robust and resilient body. And you can almost think of this as an opportunity to kind of explore that body and find different things you can do without the usual level of prescription you might receive. So I really want my clients may have pain, but they are safe to move and give them an opportunity to do so. I think
You're cutting out there, Tom. We'll try and bring Tom back on. Just
the skills, our empathy, our advice, our exercise. You lose me there. Yeah, I think really trying to push those things that are most useful. I think the things that we do in person that we sometimes rely on overly, the manual therapies, the electromodalities, these aren't actually well supported or evidenced, particularly in dealing with chronic pain. So I think this is a great opportunity to really hone in our skills on the more communication and education side. So if we look at exercise as a medicine, which I like to, then the next question is, what's the correct dosage? So I think clinicians, when you're talking to your clients, I think really keep it simple. I think give loose parameters and allow that exploration again. So if we're breaking it down into, say, cardiovascular, then I think encourage people to explore body sensation. So I don't mind what the movement is, and the body definitely doesn't care what the movement is. So I think anything you can do consistently enough that you feel flush, sweaty, maybe a little increase in heart rate, then all of these things are signs of an increased demand on the cardiovascular system, and we need demand to create adaptation. So I think, again, really looking for guidance in the body feedback loop there. And this can be dancing, this can be walking, this can be running, this can be interval workouts. I don't mind and the body doesn't mind. I think when we're thinking about what's safe and what's not, I think rather than types of exercise, there's no intrinsically good or bad ones for people with pain. I think we need to think in terms of capacity, and we need to think in terms of readiness. So is this something your client or yourself can readily do? Is this comparable to a task you normally ask of your body? And if it is, then absolutely crack on. And if it's not, then we say, well, what are the steps we need to do to build up to that activity? The other broad category I would say is resistance exercise. And I think this often gets overlooked in the pain part. Very important. I think the muscles, the bones, the joints, the tendons, they all need stress and they all need load to maintain their health. But when people have pain, I think there's a tendency to shy away from this. And again, this is a great opportunity to really reinforce that loading is safe, loading is important, and really empower people to feel that their bodies are strong, even though they have pain. You can still have a strong and capable body. If I'm encouraging people to do some resistance work, I would again use kind of loose guidance. So that might be enough repetitions that your last one is difficult. So adaptation, in terms of pain below this threshold, then we're really thinking of more of a perceptual sensory change. So we're trying to have some change in our sensory processing for important. Equally, there's a few different reasons. The one I really go to for people most is actually YouTube. So again, I think the more we step back from being prescriptive and the more we tell people, go at it, find something that's fun for you. I think the message there really is that I, as a practitioner, am not afraid of you doing harm. I'm happy for you to explore, and you should feel safe about that. I think the more we can step back of trying to control movement, the more confident our clients can maybe become with their bodies too. That being said, it is difficult to generate ideas sometimes if you're not someone who exercises a lot. I appreciate. So there's a few sort of resources here. The Quarren Train one further down, this is actually a group of physios, I believe, out of Holland, who have also got some British physios from the NHS involved now, and it's kind of growing all the time. And it's just a really cool database with some short videos of different workouts and exercise ideas. Free Trainer is a big exercise database that you can direct people to. But as I said, my preference is always YouTube. I think the best type of exercise is the type that people enjoy because they tend to keep doing it. So if you have kids in pain right now, my favorite question is always, hey, if you had a magic wand, what's your secret adventure in your heart that you would most love to do? Do you want to be a ballerina? Do you want to be a ninja? Whatever it is, chuck it in YouTube and say with the affix, begin a video and see if you can follow along, explore and practice and find something that's meaningful and fun to you. And yeah, that's probably my big tip really. Just work on those soft skills, work on listening, work on empathy, work on education, and really give them some free rein to explore those things. If anyone has any questions or feedbacks and they'd like to chat more about this, best place to find me is on Twitter. You can find me here, and I'm happy to chat about any of these things, and always keen to learn too if anyone has some. Yeah, thank you very much. I'll hand over there.
Okay, well, first, I'm Jennifer Cortogino. I'm the psychologist at Children's Hospital at London, and I really want to thank the organizers for creating this opportunity. I think one of the things that's really struck me working in the area of chronic pain since COVID-19 has come upon us is really the sense of community as we all try to figure out how to provide care and resources as things are changing. And some of the themes I'll try to go through quickly to leave time for questions. But as Tim, Tom, and Delane kind of mentioned, this is a time where we're dealing with change and some unpredictability and being adaptable. And I love, Delane, that you mentioned the importance of adaptability. Really figuring out the focus on what's important and being creative and caring. This is not the time to be perfect as we try to manage stress and change and try to create some routine in our lives. I think about this model, those that work in pain will be very familiar with it, or in psychology, that we're really looking at the link between our biology, our social circumstances and environment, and our psychological sort of pieces of ourselves, whether we're thinking about that as caregivers, as parents, or as children and youth with pain. This is sometimes where we look to understand what things may be making for more challenges or flares with chronic pain. But to me, it's also a place that we look towards strength, resilience, and what tools we're going to draw from as we adapt. So some examples that were already mentioned are things like staying at home. Certainly that changes. Staying at home right now is a strength, a tool. It keeps us safer physically, but socially there's a disadvantage. It's harder to see people and connect. Not having school obviously is a huge, as Delane pointed out so well, for many of the children and youth I work with, school is a great distraction. It's a place where movement's incorporated naturally. There's support. But for some, it's a significant stressor, and staying home may actually feel easier right now in some ways. And so this is really about the individual within the context of the family. And there really is no one size fits all as we try to figure out how to move forward and how to continue to manage stress and pain. Families as well. As we talk about kids, it's so important to think about the impact of the family. Many parents right now are trying to juggle creating a routine for their kids at home, parenting, and doing work from home. And that not only are we trying to manage stress in the children and youth that we treat and think of, but also acknowledging how significant the stress can be on families, on parents as they adapt. Some of the big things that were highlighted, and I couldn't agree more with, is the importance of routine. And how do we do that when routines have changed so much? And how do we pick the things that might be predictable, consistent, and doable? So some of the things that we'll emphasize and the what do we do now is, I think the routine I can't emphasize strongly enough. I think no matter what developmental level, whether it's a young child, an older teen, routine keeps our bodies understanding and predicting what to expect and moving and working forward on our goals. So this is something that's going to look different right now, but we know that poor sleep makes pain more challenging, can increase flares. Worry can impact sleep. So it's really putting all those pieces together to try to stay as healthy as we possibly can. When I talk about changing the channel, I'll talk about that more in a minute. It's sort of what Delane mentioned at the beginning, the idea that for some, school was a really good distraction from pain, and we don't have that right now in the same way. So we need to make sure that we're creating other distractions and things to focus on. And for the parents out there, the idea of self-care, modeling taking care of yourself and having some of those routines and finding things that make you feel good as well is so important. It's a time of creativity. I laughed as I saw this meme come up because I think we're all finding new ways to connect and stay connected. And I've been amazed and impressed by the creativity that I've seen. So from the healthcare professionals, for patients out there, you may not know that we're all really working hard to try to stay connected. Some of us are less good with things like Zoom than others, but we're trying. For families and social connections, and even sports and activities, I think it's a matter of being creative. I have a child in a sport, and they're now doing group video practices that incorporate both some physical and just some connection as a team. So if you're either a coach or you have a child and you're trying to figure out how to keep them connected, be creative and have fun with it. This was with the permission of our team. This was us doing rounds this morning. So again, the message is, even if you're not feeling connected to your team is likely still out there and caring, trying to figure out how to meet needs and to share that. So we're all still working together, even if it may feel like we're quite far apart. Another thing that I think as we look at so much news and unpredictability right now, and some of the messages that can be really anxiety provoking, especially if you've dealt with health issues and had health concerns, is the idea of really focusing on being present. There's a lot out there. There's apps on mindfulness, but the idea is that really we take some break from worrying about what's happening tomorrow, focusing on what may go wrong, and doing simple things like turning off screens during a family meal, having some home spa time and having fun, modeling that self-care and having fun with your kids, reimagining activities. Maybe you were looking forward to camping, but is there any reason you can't pitch the tent in the backyard and make some s'mores? These things don't have to cost money. They don't have to be elaborate, but it's really about taking the things you have and just taking the time to notice them. Easter's coming up for many. I know if you've done the comfortability workshop, there's a fantastic chocolate meditation in there. So take the time and just enjoy that chocolate, eat it, notice it, and take a break from the news. Practice non-judgment. This isn't about being perfect right now. Some of the kids I work with are incredibly strong academically and motivated. This is stressful. Things like missing graduation or parents working from home. Again, focus on what you can, when you can. Focus on what you and others are doing, not so much the things that you can't, because that is a hard message right now. I always think about the kids we work with and ourselves, probably as healthcare practitioners, with a little bit of a Winnie the Pooh analogy. So we've got the Tiggers out there. I work with lots of Tiggers and know lots of Tigger colleagues who are going to have trouble staying still. They're going to be bored without activities and need movement and activity to stay healthy and well. So again, this is about creating a routine where you remember to add in some physical things, some movement. It can be physical chores, emptying the dishwasher, but it might be playing outside. Just remember to move. Be creative and have fun with it. and chunk screen time. I know if you're a working parent right now, it's hard not to rely on that. And there's many good ways to use technology right now, but putting in those movement breaks can be really important. For the Eeyores, these are people who may have a harder time getting out of bed right now, who may be noticing more scary thoughts or sadness, and maybe default to less activity and not moving, or feeling like they're really doomed. We, of course, want to watch for increases in anxiety and low mood, signs of depression. But again, the message is the same. Routine, maintaining the sleep-wake cycle, trying to get out of your bedroom or at least out of bed, and getting kind of mixing up quiet and more active parts of the day. Encourage your kids to be part of creating that routine. But for kids, rules and some consistent routine are things that signal stability and safety. And for the poos out there, I laughed yesterday as I was thinking of what people were wearing to work these days, or if you're working from home, don't forget about self-care. There is power in a shower, and remembering to still get up, model getting dressed, doing those simple things that make you feel like the person you are, and also set some of those routines and expectations are important as we change and adapt to life at home or not going out as much. Staying connected, again, I've emphasized. And perhaps one of the most important things as we think about children and youth and the message that they're exposed to is to really watch the developmental level of the information that kids are getting. We can be tempted to try to really explain and over-explain what's going on, or just simply have the news on often. And I think it's really important to minimize the constant exposure and messaging. Ask your clients about other activities. Just asking what kids are concerned about. It may not be COVID. It may be, how do I do a birthday party, or just the usual things. And I think validating and just hearing what kids' concerns are at any level is important right now, because while we may be hearing about more kind of concerning or serious things, whatever is relevant to the child is what's important to kind of give some thought to. So there's some great resources that have been coming out. There's a wonderful page from the American Psychological Association that just came out on the topic of resilience, and that's a great resource that I wanted to highlight. As well as the Canadian Psychological Association has psychology fact sheets. So for those with questions, these are fact sheets that have been put together for the public, as well as professionals. And some of them right now are really both specific to COVID-19 and how to help kids with that from a mental health perspective, but also specific to chronic pain, including one that's geared towards kids with cognitive impairments. So those are great resources. The wonderful thing about pain, the pain community as well, is long before this started, there's a real drive to make information accessible. And so I've highlighted the Comfortability right now. We offer it here, but that's a wonderful site where they are doing monitored chats for teens and parents right now. There's wonderful interactive material for families. There's some other websites and apps that I'm mentioning there, and I'll make those available. As well, I know Children's Hospital here, that's Child Life Specialist Kenna Patterson and Rod Lim from Emerge, who just put out some information for kids on how to talk to kids about COVID-19, and that's the link there on the website, and some great resources. So I think hopefully the message is kind of finding ways to keep the routine, knowing that you're not alone and that there are both great resources out there and your teams are working. And I'll hand it over to questions.
Thank you all. Just a reminder to type your questions in the question box. We have a few here, and I recommend folks just typing away. There's a number of comments. One from a number of parents have thanked you all for acknowledging the role of families and parental stressors during the pandemic, and that anxiety is exacerbating in the children at home who are experiencing pain and going through the pandemic uncertainty like the rest of us. A question on, could you please speak about helping youth address their pain when they are all of a sudden thrust back home from college and home is a toxic environment for them, and how this exacerbates their pain and can we help them manage? So kids returning from college and some conflict at home. Anyone able to respond? Perhaps we'll start with Jennifer.
Sure. I mean, I think that's, again, highlighting that this can affect any developmental level. So our older children and youth, thinking about ways for them to stay connected. I think of kids coming back from university or college and having to recreate that space at a time when everyone's at home, which probably wouldn't have been the case before. I think hearing on the Comfortability website, there's a wonderful clip on reflective listening in the parents section. There's just a video there in terms of really hearing some of the concerns and engaging your young adult or your late teen in helping to identify some solutions. So that would be one suggestion for sure, is kind of looking at how to recreate space in a routine after they've been so independent and they're now back in the nest where it's pretty close quarters.
Thank you. We did get a comment that relates to this. Maureen from Comfortability has spoken. In addition to their chats, they're offering webinars for parents, and the first of those webinars is showing on Friday. We'll share the link to that in the email that will come out to you by Friday with the recording of the webinar. Elaine, did any of the comments from your co-presenters raise any other questions or issues for you from the perspective of someone who's living with pain?
That's a really good question. I think that, as Jennifer mentioned, the importance of routine, and I mean, I know I've been trying to come up with a routine and really stick to it, but I think some of the suggestions that Jennifer made in terms of keeping a routine, I'll try to work some of those things in. And something also that Tom said about making exercise fun, I think I'm going to try to do that as well. Just trying to find other things that I could maybe work into my exercise routine that could help with that.
Thank you.
Paula, it's Katie. I'm just seeing another question in there that maybe would be directed towards Tim. What is your advice for children and youth without access to therapeutic injections at this point?
That's a very, very good, important question. There are significant barriers to getting into hospitals or facilities where they can continue that type of care. And at this time, I think that we need to ensure that the usual other components of chronic complex pain management are well supported and maximized, including all the things that we've talked about, the biorhythms of sleep, eating, exercise, and stress reduction, family well-being, and finding fun things to do, and at the same time engage with your team, particularly the physicians, to maximize medication benefit and reduce side effects of drug interactions, and perhaps explore other medical options that that might take the place of an intervention. But yes, that this is a time of great limited access to in-hospital or outpatient care.
Thank you, Tim. And
Jennifer, go ahead,
go
Paula.
No, go ahead, Katie.
I was just going to say, Jennifer, I think there was another question about anxiety being exacerbating pain in both in teenagers. Just wondering if you wanted to further elaborate on anything there.
Yeah, I mean, absolutely. I always look towards what were your worries before this worry was added. If you were a good worrier or struggling with anxiety, certainly there's many things that people are dealing with right now that would add to that. There's an amazing, I mean, there's so many good resources, and I know Skip has already posted some of them in terms of coping with anxiety, like anxietycanada.com. I'm going to say it wrong, but there's great resources there for children, youth, and parents, and adults as well. I think keeping in mind some of the relaxation and making time to take a break from what's happening right now is important. And as parents, I think the most important, perhaps, point I would make is just to ask your kids how they're doing and what they might be worried about. Because I think we as parents may also have assumptions about what they might be worrying about, but it could be very different. So, make the time to ask and check in. And then there are some great tools available. Of course, if you have someone, a clinician that you connect with, that's a great thing to be raising with them. But we're so fortunate that there really are some great resources and apps available as well to help us through this. I don't know if there's a more specific strategy or particular type of anxiety that people are worried about.
If so, go ahead and type in the question box and we can raise it again. There's a clarifying question, Jennifer, about the youth returning home from college to that toxic environment. Your response related to caregiver, how to deal with that from a caregiver point of view, but they're also concerned about these kids coming home. Their pain is exacerbated. Their parents don't understand or aren't necessarily willing to learn about chronic pain. What suggestions might you have for the young people in that situation?
Well, I do think right now, keep coming back to the comfortability, but I know they have a teen chat that's also moderated by members of the team and have patients there as well, former patients or people with chronic pain. I think peer support, if you don't know someone else who may be going through the same thing, being able to connect with peers in a safe way is really, really important. Being able to find ways to reconnect with your friends and to look towards that toolkit that you would have used to help yourself through stress and dealing with some of those challenges. It's pretty individual. Obviously, there's safety issues. If you're in an environment that's so toxic that it's unhealthy and not safe, I think reaching out, there are some helplines and crisis lines that you should be calling if you're not feeling safe, to get advice on where you might be able to find safety in your community. For sure, if the issue is safety, that's important to reach out. I don't necessarily think that that's what the question was about, but I do think it's important to mention that even as we deal with this situation, people still need to have the fundamental things they need to feel safe and secure.
Fair. Any other questions, Katie?
No, I don't see any more on there. I mean, and it looks like we're getting towards the end of our time, but thank you to everyone. And please, I know there's some active projects and research to learn more about how COVID is impacting kids in pain and their families. We'll be sharing some of those resources and studies as they come out through our SKIP network. So please continue to watch out for that. There's lots of interest, I think, through various policy and institutional levels about how we can ensure kids with pain and their families are supported through COVID and moving forward through some of the larger pain initiatives that have been ongoing throughout the country. So please share, please participate, please let us know, and we'll look forward to continuing to support as we can.
Thank you. And thank you to Skip for co-hosting this with us.
And huge thanks to the speakers.
Yes, thank you, Delane, Tim, Thomas, and Jennifer for sharing your time and expertise with us today. There are a number of thank you comments in the question box, appreciating the fabulous and helpful webinar. And Children's Healthcare Canada hosts our Spark Live webinars every week. It's always great if you can watch live as your questions and comments enrich the discussion. But if you can't watch live, we have recorded all of our sessions, and they're made available after the fact on our Knowledge Exchange Network. You'll receive a email with a link to that site by Friday at noon. We've recently provided several COVID-related webinars that might be of interest to our members. Stay tuned for in additional COVID offerings. And if you haven't already done so, please sign up for our Children's Healthcare Canada Spark newsletter to stay up to date on our activities and events. We do have a non-COVID related webinar coming up on May 6th. And during that webinar, we'll hear from Drs. Purnima Sundar and Chaya Kulkarni about a partnership between the Ontario Centre of Excellence for Child and Youth Mental Health, Infant Mental Health Promotion, and the School Mental Health Assist in Ontario to advance lifelong mental health of Ontario's children and youth, starting in the earliest years. So thanks again for joining us today. Thanks to Children's Healthcare Canada's valued member partner, SKIP, and for supporting our webinar. And hopefully we'll see many of you back here in the future. Bye for now.